What? Elaine BombShell news. Dr. Paul Wright speaks about Achilles tendon injury and the impossibility of coming back.
All right, welcome to the SportsGlobe YouTube channel. Thank you very much, fans, for joining us today. And we appreciate you. I want to tell you that we love the support that you have been giving us. And as we continue to grow the channel, we're going to be injecting a lot of new faces and a lot of people and a lot of our people that we had from way back when we had the newspaper. So this evening, we want to catch up with one of our longtime columnists that used to write in the paper, which is, I know is the big man in sports medicine in Jamaica, and I don't know if it gets any bigger than that, but I can tell you that much from where I come, right?
Mm.
So I want to bring in Dr. Paul Wright. Dr. Paul, welcome to the Sports Club YouTube channel.
It's good to be with you again, Richard.
Yeah, man, wonderful. I must congratulate you. When you get your award, is this year or last year?
Last year.
Last year.
Yeah.
Congratulations, man. I'm just really happy to see, work put in and the country recognized work put in, because I know you
Yeah,
do a whole lot of work that you're not being paid for. So to even be honored, I
yeah,
know
yeah.
that.
That was the cause of my mentor, Professor Sir John Golding, who started the
Yes.
Sportsmen Association.
Hmm.
And I tell you, he used to preach that you
Yes.
must always be able to give back something because you got something in order to reach where you are. So give back.
Exactly.
And I've
That's
been following that.
fantastic. That's fantastic, man. Fantastic, Dr. Paul. Big congratulations. I love seeing that. Well, today we want to talk about, Elaine Thompson is in the sphere of discussion in sports media these days, internationally and locally. People coming up against Utter Bolden, the one time, the sprinter, the Olympian from Trinidad, who made a comment some time ago and even recently remake the comment that Elaine might not be coming back at all. In terms of her, even if she come back, she will not be who she was before running 10.5.4 or 10.6. She will not be there at all because she had been out of competition for a while. So I have a couple of questions for you, Dr. Paul, that I wanted to shed some medical light on it, to let us understand, break it down for our basic fans out there for them to understand, what she's going through and what are the possibilities for her to come back. So my first question for you is going to be, we hear from Stephen Francis, 2 years ago that she has a major injury that she has been working with ever since, right? Is an Achilles tendonitis. It's an injury that she have and she had been working through it. I don't know exactly if it's a tear or a strain or whatever it is, but it sounds like it is major, why it is affecting her so much, right? But you can break it down for us to tell us if it's a strain, if it's a tear, if it's, you know, um, anything else with it. Explain to us what is really Achilles tendonitis. What is this injury all about? What is it looking like?
The Achilles tendon is tissue that attaches muscle to bone. That
Hmm.
is what a tendon is. A ligament
Okay.
is tissue that attaches bone to bone. So the
Okay.
ligament is bone to bone, the tendon is muscle to bone. So you have the
Okay.
gastrocnemius muscle, that is the calf
Hmm.
muscle, and that
Hmm.
is attached to the heel bone, which is the calcaneus, by this
Okay.
long tendon. And that is the thing that
Hmm.
pushes you off the ground. Okay?
Hmm.
So that Achilles tendon is very important in sprinters for the push that gets you off the ground and that accelerates when you accelerate. If you watch Usain Bolt coming out of the blocks, he is
Yes.
slow, stretching, and then he gets into top speed at about 50, 60 yards. He gets flying, and then after that, it's just momentum brings him home. So it is the Achilles tendon and the push that gets you going, and then you develop your speed after that. So if you injure your Achilles tendon, there are several different types of the injury. You can start with a strain, where the tendon that consists
Hmm.
of of fibers are,
Okay.
are torn but not torn apart.
Hmm.
Then you have different degrees of tear. You have grade 1, where it was barely torn, grade 2, where they start to separate, grade 3, where most of them separate, and grade 4, complete separation, and you're going to need surgery to
Okay.
repair that. Okay. So if you start at what seems to have been the problem, because I have no idea what kind of injury she had, let us say it's a grade 2 injury, where most
Mm-hmm.
of the fibers were injured in the Achilles tendon, and she has now got to heal the tendon. We
Yes.
must remember all the time that muscles and tendon heal by contraction. It's a long strand of say, fibrous tissue. You
Right.
tear it, and the two pieces are together, right? It is
Mm-hmm.
going to heal. It heals by
Mm-hmm.
contraction. Let me see if I can explain it this way.
Yes.
If you get a cut on your forearm, right,
Mm-hmm.
and just leave it alone, it will eventually stop bleeding unless you have some bleeding disorder. Okay, and
Right.
the two
Mm-hmm.
sides will come together again with a scar in the middle. That
Right.
means that the two edges grew towards each other and were stuck by a different type of material. We call it scar material that makes the
Mm-hmm.
thing heal. And you see, all you have is a scar on your skin. The
Right.
same process take part in when you heal in tendons. Okay, the two tendons are nearby to each other, and they heal by contraction. The tendons stick together and they
Mm-hmm.
overlap. So if you have a jacket, the jacket you have one end over the other end, it
Yes.
heals shorter than how it usually heals. That is how
Right.
these things heal. So when you have an Achilles tendon, as her coach has had hinted, I don't know if he
Yes.
made it plain, is that you have to manage this thing in an extremely positive manner. You have to let it heal at its longest strength. In other
Mm-hmm.
words, in metropolitan countries, in foreign countries, when you have that type of injury, you have
Yes.
put you go to sleep in a machine that moves your tendon down and up, keeps it moving
Yes.
while it is healing. So that by the
Oh.
time it is healed at its maximum length. Because if it is healed at its shortest length, the moment you
Mm-hmm.
pressure it at top speed,
It
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 will
will tear
re-tear
again.
and bleed again. And it is chronic Achilles
So how
tendonitis,
how
the
long is that
bane of
process?
sprinters.
How
Go
long
ahead.
does that process
Well,
take? That healing process?
the, the healing process is anything from 2 to 6 weeks. So you have to be very careful about how you manage this thing and how you get them back. You have to keep that ankle moving in such a way that it heals
Mm-hmm.
without contraction, heals at its fullest length. And when it heals at its fullest length, then you can start to do high performance work again. So even while it is healing, and it is the first 2 weeks or so,
Mm-hmm.
you don't go back in top speed work or half speed work. You
Mm-hmm.
quarter speed work that barely putting weight on it and pushing off so that you keep the tendon at its longest length while it is still healing.
Right.
And it is when it is fully healed that you go back to top speed work. And that is where the coaches come in. Not the
So
relative, not the athlete, because if it is healed, you're going to feel that, yes, I'm ready now. I'm going to sprint at top speed and it's all over. So that is
it
where the
tear again.
coach comes in, who understands the injury and knows how to manage it. And I think that is one of the features of our Jamaican coaches. I don't think people understand how great our Jamaican coaches are. Well, no,
Yeah.
they do now because they have proved it over and over again. That Glenn Mills and Stephen Francis, and even the
Yeah.
coach of our young Olympic champion, who was
Oblique
trained
Seville.
with
Mm-hmm.
Stephen. These are not normal coaches. And these
Yeah.
coaches, if we ever export them, we won't have any foreign exchange problem again, because people don't understand how great these coaches are. And
Yeah, they're very good.
I must say something about GC
Mm-hmm.
Foster. GC Foster has revolutionized coaching in this country.
Yeah.
They had sports medicine coaches, and I used to teach there at one time. They had other people. The president out there, Maurice is a master coach. So
Yeah.
this is the sort of background
Maurice
that these
Wilson.
coaches
Mm-hmm.
have. Yeah, Miles Wilson. And when these coaches graduate and go out into the schools and the clubs, they
Mm-hmm.
see Cambridge High producing fantastic people, Magati producing great people, Foga
Yeah,
High,
man. Yep.
William Nib. That is the sort of thing that has happened to
Yeah,
sports
man.
in Jamaica, and along with the champs. I believe that if we keep that up, we are going to be unbeatable. We just have some little ebbs and flows where we back
Yes.
off a little bit, but so we are right back again.
We're going to
So
get
it is
there.
the coaching, and it is the coach who realizes takes time to heat, how you get them through that program. They keep the ankle moving, keep the pressure off it, and it is fully healed. And you start them back on the long, slow work. Then you go to quarter speed, then half speed, and then full speed when it is fully hurt.
All right. All right.
Now,
So,
there's
Dr. Paul,
another way.
let me just welcome Rudy on. Rudy, Dr. Paul Wright. Of course, our friend, and of course, sports medicine doctor, highly, international sports medicine as well. Yeah, man. So
Yes,
welcome,
a pleasure.
Rudy. Dr. Paul, meet Rudy.
Yes, a pleasure to have
Hi,
you on,
Rudy. How
sir.
you doing?
Yeah, I'm
Right.
doing well.
So,
I'm
Good.
doing well.
Okay. Good.
yeah, man, Rudy is a past Olympian for Grenada. So, so Rudy, Dr. Paul had gone through
Probably Rudy
telling
can
us
tell
what
us
is.
how Grenadians handle Achilles tendonitis because it is a universal injury.
Yeah.
It certainly is. It certainly is. And it's the same thing. We depending on one of the areas that we are depending on Grenada is to put making sure that we have the proper medical doctors in place that can work on injuries. It's something that's been lacking for a very long time. Me as a youth, we growing up, we never think we're going to be injured. We just play, and sometimes we even play injured. Especially we play cricket, we play football, then we start running track. But now it is just something that is so different now. When you see a lot of these athletes now that the injury prolong compared to in my days, you have an injury, next day you're okay. Um, so I don't know if it was the remedy that was used by our grandparents by using the natural herbs and the natural stuff on it compared to today. I don't know what it is, but certainly I know in Grenada they are working on putting things in place to make sure that we have medical doctors like yourself in the field of sports that can help those athletes.
Dr. Paul, anything goes with homemade remedies to treat these kind of injuries?
Well,
Anything
what
goes.
what he's saying is true because in
Mm,
my time, and that is
yeah.
in the 60s, if you sprain your
Yeah.
ankle, if you
Yeah.
sprain your ankle in my time,
Mhm.
you were told it better be broke because you're not going to get better. We knew that.
Never.
But now we see footballers in the English Premier League severe
Mhm.
injuries, and the ankle
Yeah,
are now sat down for them Saturday see them playing again. Because we now
Again, yeah.
revolutionize how we treat those things. Because when it comes to the ankle, and I'm just going to switch to the ankle a little bit. We used to treat ankle sprains in my time by coming off it and putting you on crutches until it heals properly.
Yes.
And the
yeah,
amount
Right.
of time you come off it on the crutches, the amount of time you take to come back to full performance. Now, sprain ankle, you stay on it and you continue moving same time
yeah,
while getting the treatment. So
When we
it
get
is
in the treatment.
revolutionizing the treatment and understanding exactly how to manage these treatments that allow athletes to come back quicker than how they used. Because I tell you, in my time, you sprain your ankle, why Pablo, better your foot did broke, because you know what you're talking
Yeah,
about.
man.
yes, yeah,
All right, Dr. Paul, I'm going to ask you a major question because you allude to it a little bit,
Yeah.
but I want to go to the extreme of this Achilles tendonitis injury. Let's say we got to stage, the athlete got to stage 4, because tell you what,
Yeah.
Elaine Thompson have been having this situation throughout her career. What Stephen Francis says is that he has been managed. So, based on what I heard him say, she would have done everything already, the surgery, the whatever. So, I want to take it to the extreme. Let's say it is the extreme 4, right?
All right.
What can
Let
be
me tell you
done
about
to
the
help
extreme
her?
four. I had
Hmm.
I had one case of the extreme four. It was an athlete with an Achilles tendonitis who did everything correctly. Everything correctly. And the moment he moved from 3/4 speed to top speed, pain. Okay? We did all the
Hmm.
tests. It was not separated, but he just couldn't
Hmm.
manage. So we decided to take him one day to the Andrews Hospital and we operated on the tendon. And
Hmm.
my mentor at the time was the great Professor Sir John Golding, okay? And
Yes.
he hinted me at what I might find when I opened that tendon, because this was at Andrews, and I was with Prof
Yeah.
at the university. Well, when I opened
Right.
the tendon, and you have a scalpel in your hand, and the tendon
Hmm.
is a long, is a set of fibers. You just put the
Yes.
knife in the middle of the tendon and call it
Hmm.
and carry it down the middle. So you're not
Hmm.
separating the fibers, okay? So you're not going to
Right.
make it worse. And to my surprise, what I was told happened did in fact happen. a kind of grayish gunk came out. Okay, that was the sort of thing, some fibrous tissue that was creating a problem at top speed. Okay, and if you just make a series, I made about 5 longitudinal cuts in the tendon, in the length of the tendon, and extracted most of the gunk that I could. Okay, put one suture around it, and a kind of circular suture. Okay,
Right.
used the same healing process, got him back. He was never back to his top speed. Never back to his top speed, but he made his team. And it was that, I call it gunk. It was a chronic thing. So we used to, when I used to teach, that was when I had black hair, I used to tell them that when you reach into theater, try that technique with these people. It's not a true tendon. You're not going to be repairing the tendon. But just use the knife in longitudinal cut down the middle. You're not dividing any tendon. And you have the tendon.
Yes.
You're going to go and you're going to see some gunk coming out. It is amazing. And that is what is causing the problem and the pain at top speed. And it helped in that one athlete. But that is only one time I ever do it. But I know from experience, I was a member of the American College of Sports Medicine. And they used to go away every year to their annual general meeting. And, you know, they're sports medicine doctors who only operate on ankles, only operate on wrists, only operate on elbows. Those are the type of people that are in the United States. And I always went to the ankle and the elbow injuries and the shoulder injuries. I always went to those lectures and they would tell you the same operated, you have to repair it. Okay? And what you try to do, you have to repair it, as I was saying in the early part of the thing, at its longest length. And you keep it at its longest length. So that when you immobilizing the ankle, you immobilize it with your toes pointed as far down as possible, so that the length is the length that you want it to heal at, that it's not going to contract. Because if it's healed in a contracted position, the moment you stretch it, it is going to re-tear, and you're going to be right back to where you are. But nowadays, they have what you call, when you're post up, they put you lie down in a bed, and your leg is placed in a machine that moves your ankle while you're sleeping. So while you're sleeping, the ankle is moving at its longest length, and it is being repaired while you're sleeping and while you're awake. That is 24-hour movement of your ankle. And that is the modern way of doing it now.
So let me ask you this final question for this particular set of questions, Dr. Paul. Is a Achilles tendonitis injury, when it is totally severed, can it be repaired? Can an athlete come back from it and perform at high performance?
You remember Wanterino?
Yes.
You remember Alberto Wanterino?
Alberto Wanterino, yes.
Runner from Cuba. He ruptured his Achilles tendon stepping on the infield of a 400 meters of a race, right? He stepped on, the little aluminum thing that have to separate the infield from the thing. He stepped on that, ruptured his Achilles tendon.
I remember that,
best in the world, and came back. Nothing like how he was before. That's it.
So it's a really serious injury.
It's a serious injury, and to come back after that injury to where you were before, and you are older, boy, you're looking at 0.12%. What chance of you coming back?
But Doc, let me ask you this: is it based on the sport that you play? Makes a difference?
Yes, man. It makes them because of what you want from your Achilles tendon. In sprinting, the Achilles tendon is what pushes you off. But in the other sports, you can get away without putting the Achilles tendon at maximum stretch.
Yeah.
And you can put yourself into special boots like soccer. That stops the ankle from stretching in that position. Man, you can do that. But in a sprinter, you need that Achilles tendon, especially coming out of the block.
Yes, you certainly do.
So it is sport specific when it comes to return from injury.
I'm going